April is Cervical Cancer Awareness Month, and KOOL is all about giving you the information for prevention and care. It's time for Ask the Gynaecologist, and we have an expert here to provide the answers. Joining us this week is Dr. Natalie Medley. She's a consultant OBGYN and gynecological oncologist. So we want to welcome Dr. Medley to KOOL97. How are you, Doc?
Good morning. Thank you for having me. I'm doing well.
Okay, fantastic. All right. So cervical cancer awareness is what we're all about. Can using birth control increase or decrease my risk of cervical cancer?
The birth control pill has been linked to HPV infections progressing to cancer. We aren't sure of the exact mechanism, but the risk is really low compared to the overall benefits of the pill, contraception and so on, and other reasons to use the pill. So we reassure patients that using the pill is okay if they need to use the pill for, whatever reason. However, continuous screening, doing their pap smears, being monitored regularly, the risk of cervical cancer from it is very low. But yes, there is a theoretical increased risk. We're not really sure of the exact mechanism. One school of thought is women who are on the pill may not use condoms because they're protected from pregnancies, but the risk of transmission of HPV, STIs is there.
Can HPV be spread in other ways as well?
Yes, HPV is said to be the most common sexually transmitted infection. However, I look at it in a different light from traditional STIs like chlamydia, gonorrhea, and so on, because it can be spread in so many different ways. Just genital to genital contact, hand to genital contact. Persons don't have to have penetrative intercourse for HPV to be spread, right? And even oral sex, anal sex, several different ones. There's genital contact, and also HPV also has been linked to cancers of the throat, right? Or we call the oropharynx, the back of the mouth, right? So it's several different mechanisms in which it can be spread. So not only from sexual intercourse.
I know someone who was treated for cervical cancer in their 20s, and she's doing much better now. But one thing that's been weighing on her mind is whether the treatment might affect her chances of having children.
Mean age, or the average age of women with cervical cancer is in the 40s to 50s, and even younger. She said her friend was in her 20s. So we do see a lot of younger women being affected. The treatment can impact fertility, especially if it's diagnosed at a late stage, where we have to do surgery or radiation, that the fertility will be compromised. If it's detected at an early stage, which is what we want, to pick it up when it's just microscopic cells, changes which we can't see with the naked eye, but it's picked up because of findings on an abnormal pap smear HPV test, we can do a lot more to preserve fertility. In that case, we can remove a portion of the cervix, remove the entire cervix itself, and leave back the upper parts of the the uterus. So we have a lot more options to preserve fertility in the early stages. In advanced stages, however, then, hysterectomy would be recommended to preserve life, and health, and even radiotherapy in a more advanced stage. However, even in these late stages, though, we have fertility specialists that we can dialogue with, younger women to help to preserve the ovaries. So they have an opportunity to have a carrier using their own eggs. So there are options that can be explored even in advanced stages. But the key is, earlier detection increases the chance of preserving fertility.
We've been joined by Dr. Natalie Medley, and we want to thank you, our listeners, for your questions and also for tuning in. And again, many thanks to the Jamaica Cancer Society for partnering with us on this program. Thank you, Dr. Medley, for joining us.
Thank you again for having me.
All right, blessings. Take care.